Hi guys, I'm Dr. Donald Pelto. I'm a full-time podiatrist in Worcester, Massachusetts. Welcome to Podiatry Practice Mastery, where I help other podiatrists develop successful principles and skills in their private practice.
Hey guys, Don here. Welcome to Podiatry Practice Mastery. Today, I want to go over my weekly update. I'm preparing a lecture. I'm going to be giving it at the AAPPM, American Academy of Podiatric Practice Management. If you don't know, it's a great organization if you want to learn more about practice management. And one of the presentations I'm going to go on and talk about is doing my patient presentations. If you haven't heard about those, this is something that I use every single day in the office. And I was just looking up how long I've been doing it, and I pulled up my first patient presentation, and I'm going to show that to you right now. I think you're gonna like it here. So let me just share my screen here with you. Okay, what you can see here is my first patient presentation. If you look, this is my one from 2012. Let me tell you the backstory of this. I just had a poor surgical outcome, and I had to deal with this with a patient. And I thought to myself, well, if I could do it over different, what would I have done differently? And that brought me to this idea. Well, if I could have done it over again, the whole issue was they said I wasn't really clear on what I was doing for surgery and what my surgical plan was. So what you can see here is this is before surgery, before, during, and after. What you see here is what they would expect before surgery, during surgery, and then after surgery. This was my first presentation, and I started to do these with PowerPoint on my computer screen, and then I switched them over to Google Slides, which I currently use. So I just want to share what are the main components of these patient presentations, and then I'm going to show you the ones I currently use, and I'm going to teach you where you can start using mine if you'd like. I find that Google Slides works the best now for the presentations, just because you can do it anywhere you want. You can do it on your computer real easy. The important slides, I feel, in the beginning, I had like 30 slides in my slide deck, and it took me forever to do it. And I've kind of slimmed them down to 4 or 5 slides. If I'm going to show you in some of my slide decks, what you're going to see is the initial slide deck of 4 or 5 slides, and then you're going to see a black slide, and what that is, that's kind of like a spacer slide, so I can stop, so I know where to stop. But then if I ever want to record a video, there's a whole other slide deck with common questions and other things like that. So I kind of use it as my reference. The best slides to have: a title slide, anatomy slide, an image slide, and then a treatment evaluator slide. This is if I could have one slide, this is the one slide I would do. I would print this out. I've even had some people, they printed it out and they put it in their treatment room. And when did I make them? I used the downtime between patients, and then I modify them based on my patient questions. So as patients, as I'm doing these, patients many times they have questions, and then I'll modify them, and it's real easy to modify them. So I'm going to go through this and show you. This is the current system that I use now. I call it a patient presentation tool. This you can make on a link tree. And basically what I do is I have all my presentations right here, and they are in full view mode. So if you want me to kind of show you how I do that, actually, let me show you what they look like first, then I'm going to go back and show you how to do that. This is the one thing that's really made my life so much easier. So if you click them, it's going to go to my actual patient presentation slide. So what you'll see, this is my bar up here with all my folders. And here's the patient presentation slide. This is the same thing I do. So what you can do is you can save it. I have mine saved right here. You can see it says patient presentations. You can just as easily put a link on your website that says patient presentations or whatever you want, either way. But on here, you're going to see all these are little dots, right? Like little links, and each one of these goes to a different presentation. So when a patient comes in with a certain condition, I will go over that condition. This is called my welcome slides. So if I'm seeing a new patient, and a lot of times they ask me about my kids. So what I do for this one is this is just my welcome slide deck. So when I pull it open, it actually pulls up PowerPoints. Now, the neat thing about this is a PowerPoint. It's Google Slides, but it can't be downloaded. So it can't be, like, I guess someone could screen capture it, but this is then my welcome slide deck. Now, the one tip, if you're going kind of back and forth, you can't hit the back button because it doesn't work when you're in live slides. You have to actually use this arrow button. So if you're using these and you want to go backwards, if you do backspace, it doesn't work. But if you use this, it'll go to the previous one that I just showed. So it'll go back to the other one. Now, it also opens up another screen. You can see, so this is another screen. These are my patient presentations, so it opens up another screen. I'm ducking down because my light's here and I can't see. And so this is my welcome packet. So when patients want to see my kids, I'll show them a picture of my kids. I'll talk about the team of doctors. I'll talk about me using a virtual scribe, my booklets, things like that. But what I want to show is you don't just don't use this one. So if you're going to use my slide, I guess you can show my family if you want. You might not want to do that. But if you just take, let's take one of the most common ones. I'm going to show you the most recent one. The ones I use the most are Achilles tendonitis, Haglund's, hallux limitus, plantar fasciitis, nail fungus. But the one I did recently is on porokeratoma. So as I make these, I can just make more and more. So as I use them, so this is what I made recently. So this is another slide deck right here, and it just goes over. And this is a blog post that we did about a porokeratoma, walking on a pebble. These are the same intro slides that I always ask. How long have you had the symptoms? What treatments have you tried? How does it impact your life? And why do you want treatment now? And then I have some pictures of them. And then I talk about pressure on the metatarsal head and different areas. Here's an X-ray, and then I kind of have this little treatment evaluator, real simple one. Trim and I'll apply salicylic acid, maybe a pumice stone. I usually put a cream here. I'm going to add a cream, and then orthotics, padding, shoe cutout, and then surgical removal. Okay, so if you look, then that ends. Now let's say I want to add something to this one. What I do is I go over here, and these are all my slides actually in Google Slides. And so I just open up this one on porokeratoma. And what it does is it opens up the actual slides. The reason I don't pull up these slides every time is because I had to pull up the slide, and then I had to show it in full screen mode. So full screen mode was kind of a pain for me to do, so you had to pull it up and then do full screen. The benefit to the other one is that it automatically does that. It automatically pulls it in full screen mode. So you can see here, pumice stone. So I'm going to do pumice stone and callus cream. Okay, so those are the two things, and I don't like this, so I could just switch this. So that's how you edit them. It's real easy. And then once I edit them, if you go back, it automatically saves it. And then if you go back to this one, it pulls it up already. This is the presentation. So the benefit of the presentation is every time you're doing it, it pulls it up in full screen mode. And there are a lot of different presentations. If you guys want to learn more, I have a little downloadable thing that I've developed. It's called patientpresentations.com. So you can go there, put your email in. It'll give you access to all of these. This link, if you want to just use mine. I'm trying to keep them kind of generic so other people can use them. But there's a lot of other things that go with them. So in there's kind of an explanation, a little bit more beyond to it, a few emails that'll explain how to use them. Let me know how it works for your practice. I've really found I couldn't practice without this. And what I'm going to do next, the next video I'm going to talk about is how I use this thing in conjunction with my foot treatment checklist. So this kind of goes along with it, and I'll kind of explain how that goes in the next video. And the one after that, I'm going to explain how this works with something called Patient Education Genius. Okay. Thanks, guys.